Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
Great. How are you?
Good. So today I want to discuss with you something you offer called the liquid facelift. Can you explain to me what exactly that is and how that's performed?
Sure. A liquid facelift lifts the face by adding volume to the face. So as we get older, we tend to lose volume in our face. And a sign of aging is hollow cheeks, loss of volume in the face, and the face that sags or descends off the cheekbone. So a liquid facelift is a procedure, something we do in the office, that revitalizes the volume in the face. And by adding volume to the face, it lifts that cheek up. So it's generally done with fillers.
Do you have specific fillers that you like to use for that?
Sure. So I think our go-to filler for the face is a hyaluronic acid filler. So hyaluronic acid it's a very common filler. It's been around for a long time. There's two major brand names, Restylane and Juvederm. We tend to use a lot of Juvederm in our practice. And Juvederm makes a filler called Voluma, and they're playing on the word volume. It's a filler designed to be injected generally up on the cheekbone, sometimes lower in the cheek, but by adding volume to the cheekbone, it will lift the entire cheek unit up, moves the jowl up, and it lifts the smile lines up, and thusly can lift the face.
Okay.
Yeah.
So it's kind of like a standard injectable treatment. It's not more painful than those sorts of appointments, right?
Yeah, that's a good question. So, no, I don't think it's more painful. It's a filler appointment. Generally, we're injecting a number of syringes of the material. So these fillers are sold by a syringe. Your typical filler appointment, you might do one or two syringes of the material to add volume or to correct a wrinkle or a line. With a liquid facelift, though, it's very common to get into numerous syringes, sometimes 3 or 4, even 5 or 6, where we're injecting this material to fill up the face. The nice thing about it, you can do it in steps. You can do a few syringes now, and then several weeks from now, add more to it if you want to. So I think actually that's an ideal approach, because then you can kind of see where you're heading, and swelling isn't an issue at that point anymore. So it's possible to add some later on very easily.
So would you say there's any downtime then with this procedure other than like the normal possibly bruising that you might experience?
Yeah, I mean, there's no real downtime. Many people go back to work. Certainly if you're working from home, there's no reason you can go right back to home and hop on the computer. Probably best to avoid aerobic activity, maybe for like a day. So, avoiding the gym right away is a good idea. There may be a little minor swelling, and there may be some needle marks or a small bruise here and there. So the treatments do involve needles. We're injecting these materials, these fillers with needles. So that's the real risk. You may get a needle mark or a bruise, but most people with a little makeup here and there are out and about socially and back at work very quickly.
Okay.
Yeah.
So is there a specific person that might be a good candidate for a liquid facelift versus like a standard surgical facelift?
Sure. So a person who has a lot of skin laxity, they have hanging skin, or they might have that, hanging turkey gobbler in their neck, they're probably not the best candidate for purely a liquid facelift. But the younger person who has just a little bit of laxity or is just some of the early signs of aging, they're a good candidate, because just by adding a little volume up high in the cheekbone will lift things up and can make a tremendous difference. Sometimes even just one syringe kind of split on each side of the cheek can really make a nice difference and lift that cheek upwards and fill things out again.
Yeah. So would you say it's important for a patient to have good skin elasticity for liquid facelift, as it is so important when it comes to like surgical procedures?
Good skin elasticity makes a huge difference.
Okay.
So I think that is important. And then the other good candidate is somebody who's lost some weight. When we're heavier, our cheeks are fuller. When we lose weight, some people will lose a lot of weight in their face. That can be somewhat unattractive. A sign of youthfulness is a fuller face. So that's another good person who's had a little bit of weight loss, and just by adding some volume back in the face, it can nicely fill things out again and give you a more youthful look.
Okay. Would you say there's any benefits to someone then choosing a liquid facelift over a surgical facelift?
Well, I think the sitting down with the doctor can give you the kind of pros and cons to each. The surgical facelift is obviously surgery, and I think most people in our practice, we've tried liquid facelifts before. We've done some non-surgical things beforehand, so they kind of get a sense, for what they can accomplish without surgery, and then we'll move on to surgery as things change and as things happen where we can't correct them with a liquid facelift.
So with a liquid facelift, that you're using fillers to treat patients with that. So how long would you say that treatment would last then?
So it's not a permanent treatment. The fillers do absorb and go away, but they last a long time. They'll last a year and a half to 2 years. So what I tell patients is, we'll do a number of syringes up front to lift things up. And then the nice thing about this, we can add to it at any time. So a year down the road, if we lost a little bit of volume, we can always just do a touch more to kind of top things off and fill things out again.
Okay, great. And can you give me like a ballpark price range of what a patient might pay then doing a liquid facelift?
That's a good question. So the fillers come in a syringe. Each syringe is in the $800 range. And again, to fill out the face, it's common to use several syringes. Now, usually if we're doing numerous syringes, we do discount them as we go along because you're already there laying on the table and that sort of thing. And so there is some discounting involved. But you're looking at, again, probably as a minimum, something in the $1,500 range.
Okay.
Yeah.
Great. Well, thank you for your time today.
Sure. Thank you, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.